Well, okay, good afternoon again, and thank you for joining us today. And for those joining us virtually, we will provide you with a video feed of this shortly after the conclusion of the press conference. Now, as I was mentioning earlier, April is National Donate Life Month, marking the annual effort to both encourage donation registration and celebrate the lives saved by the thousands of heroic organ, eye, and tissue donors all across the country. So to kick off the campaign here in Michigan, I'm grateful to be joined today by Dory Dills, the CEO of Gift of Life Michigan, and heart transplant recipient Amy Bacon, who will share her incredible story with us momentarily. And let's not forget Hartley, the Gift of Life Michigan's chief mascot. Are there other mascots? This is chief mascot? Chief mascot. And the Michigan Department of State has been a proud partner of Gift of Life Michigan for many years, with approximately 85% of those joining the registry in the state doing so through our offices when they get their driver's license transactions done with the department. And with each driver's license renewal, citizens have the opportunity to simply check a box and confirm their decision to join the registry. Those who join receive a heart emblem, much like Hartley, right there, is pointing out, a heart emblem on their driver's license indicating their decision to be a donor. And nothing more is required of drivers for it to remain on their license with every renewal. And while this process is the primary method by which citizens join the registry, it's not the only one. In fact, you can join at any time by going to michigan.gov/organ donation. It takes about 30 seconds and can improve and save the lives of up to 75 people. To share more about this life-saving service and the year's registration campaign, I'm going to invite Dory up here to speak. Go ahead, Dory.
Thank you, Secretary Benson, and thank you for all that you and your staff do every day to help us save lives. We truly value the partnership and appreciate all that you've done. I want to thank you for being here today. I'm Dory Dills, and I'm the President and CEO at Gift of Life Michigan. And we're here today because it's National Donate Life Month, and that is a month that we bring awareness about organ and tissue donation and signing up to join the Michigan Organ Donor Registry. And we're also here to announce a major goal for our organization. Our intent is to add 1 million names to the registry over the next 3 years, and we've got a lot of work to do that. But we know the numbers are there. In fact, when we talk to Michiganders, we know that 90% of them wish to be donors. They want to help someone should something happen to them. However, only about 58% of those individuals have made the decision and actually signed up in the registry. And actually, that percentage is lower than other states in the United States, so I know we can do better. We want to reach the millions of Michiganders who wish to be donors but just have not taken that step. We know that there are many, many generous individuals in this state who will sign up in the registry. So today, we're launching a major campaign, in fact, our largest campaign, statewide campaign, that we've ever done in our history. And it is a simple and easy to remember, and we want it to resonate with the residents in Michigan every day. The campaign is simple. It's Check Your Heart. It's a positive action that anyone in Michigan can take. We believe it's going to lead to significant increases in the number of donors registered in Michigan. We've discovered, as I said, that there are thousands of Michiganders who think they're registered, who think they've signed up to be donors, and yet they're not actually in the Michigan Donor Registry. And Check Your Heart is really a simple process of reaching into your purse or to your wallet, pulling out your driver's license, and making sure that that little indication is there, that actual Check Your Heart. We also hope that Check Your Heart will resonate with you on a deeper level, a personal level, where you look inside and ask yourself, do I want to help someone should something happen to me? We know that people are altruistic by nature. We know they want to help individuals in need, and we know that resides within all of us. And so we're hoping that they'll also check their heart emotionally. There's so much capacity to doing good. A single donor, as Secretary Benson mentioned, can save the lives of 8 individuals and enhance the lives of an additional 75 through tissue and eye transplant, all by just checking your heart. Just look at last year. With the help of the Secretary of State and the generous Michiganders, we added 250,000 names to the registry in Michigan. In spite of an ongoing pandemic, we were able to do that. The steady growth in registrations has translated to more lives saved, to organs transplanted. In fact, in 2021, we transplanted 1,089 organs from 429 generous organ donors. That's about a 14% increase from the previous year. We also facilitated 1,464 generous tissue donors who will go on to help thousands of individuals. And as I mentioned, 250,000 people said yes to the Michigan Organ Donor Registry. This increase is happening all across the United States, and we're saving lives every single day through wonderful partnerships like our relationship with the Secretary of State and, of course, our donors and our donor families. But more needs to be done. There are still 106,000 people who are waiting for an organ transplant in the United States. And in fact, 2,500 of those individuals live right here in Michigan. We need people to sign up in the registry to say yes to donation. So we're asking everyone to check your heart. Ask your friends to check their heart. Look at their driver's licenses. If you've signed up on the registry, if you have that heart already, we thank you. You're going to save lives. But we're asking the rest of you to please take that action. You can do that by visiting our website at golm.org/register. I'd now like to introduce someone whose life was saved through a donor about 10 years ago, Amy Bacon. Amy's life took a drastic turn in 2009 when she experienced a completely unexpected heart attack. She had no prior symptoms. 3 years later, she was in hospice care. Now she's here to tell us how a donor saved her life.
Thank you, Lori. Welcome, everyone. And I am excited to be here to talk about the importance of organ donation and how an organ donor changed my life. Again, my name is Amy Bacon, and I am a heart transplant recipient, and this year I am celebrating 10 years, okay? Just to give you a background, in 2019, I had a sudden cardiac arrest. And unlike a heart attack, the only way that you can survive is if you get shocked back into normal sinus rhythm. Shortly after that, about 2 years later, just being on medications, I was fine. I started noticing that I was gaining weight. And unbeknownst to me, that was my body retaining fluid. And that's when I found out that I was actually in full-blown heart failure. And so it was decided then that I would need a heart transplant. However, my body was too sick. And so at first I had Milrinone, and that was medication that goes through an IV in your upper arm straight into your heart. And then on my birthday, on March 5th of 2012, I had a left ventricular assist device. Now, what this device is, it's a bridge to transplant. And what the hopes was to bring down the pressures that I had in my heart, in my lungs, and to make me healthy enough to withstand the wait until a heart became available. And lucky for me, God blessed me. It was actually the Friday before the Monday where it was a Friday, I got the call that they were putting me back active status. And here me and my mom are thinking, active status, okay, we'll get around to putting the bag together. Still not expecting a call to come anytime soon. And I remember sitting on my mom's couch. It was 8:07 p.m. My cell phone rang at 734, okay, Ann Arbor, U of M. They're probably just calling me for an appointment reminder. And when I answered the phone, they were like, Amy, we've got a heart for you. And I remember that feeling. It was like, you had the bubble guts and you got nervous and like, oh, wait a minute, what do I do? And then my mom was like, wait a minute. First of all, who's the surgeon? I'm like, who cares? I don't care who is putting the heart in. But we were able to talk directly to the surgeon, Dr. Jonathan Haft. And so then we started the task of, rounding up my LVAD equipment and getting to U of M. And it was a wonderful, wonderful gift. I was transplanted on June 26th of 2012. Um, Unfortunately, there's a lot of patients that aren't as lucky as me. You know, sometimes recipients can wait up to 6 months for a heart. There are some individuals, and I've had friends who have died with the LVAD or waiting for a heart. So for me to be able to stand here and promote organ donation, it's just the epitome of a blessing. There's not a day that goes by that I don't thank my donor family for the ultimate gift in the midst of the most heartbreaking, unimaginable experience any patient or loved one can ever think about. And I remember after I got my heart, it's like, my mom was like, Amy, God saved you for a reason, but no one can tell you what that reason is. You're going to have to be patient and wait for him to speak to you. And then it came to me. I'm like, you know what? I've got to give back. I can't just take this gift just sit on it. And so I started my educational journey. I got my first degree at the age of 42. I got my associate as a medical insurance specialist. And I remember I was a keynote speaker at my graduation. From there, I went to get my bachelor in health services administration. Then I went to get my master's degree in public health. And then that's where I started, to advocate towards preventative health. Primarily diabetes and high blood pressure, as you know, are the number one cause for kidney failure. And so I'm now working towards my doctoral degree in public health. And all these things would not have been possible if it wouldn't have been for an organ donor and their family who gave the ultimate gift. I don't believe that there's any gift that could top saying that, yes, you can have my organs in my demise to save another life or improve the lives of up to 75 other individuals. And that's why today is so important in checking your heart, making sure that you have this heart on your driver's license. You can't take your organs with you when you die. And I think that anyone that wouldn't be willing to check your heart, it's kind of selfish if you really think about it. It's a simple thing that can help so many people. I can't stress that to everyone enough. And so it's important that you sign up. And as Dory indicated, you can sign up on the website as well as going to the Secretary of State. And it's important for everyone to talk to their friends and family about what they may want if something were to happen. It's one less thing that a family member has to think about, okay? And so just like Dory was saying, one donor can save up to 8 lives and improve the lives of 75 people. So please, check your heart. And thank you so much for allowing me the opportunity to share my story.
Thank you, Dory and Amy. Thank you both for sharing that and for all the work that you do to save so many lives every day. And it's an invitation to people all across Michigan to be a part of that life-saving work by joining the Organ Donor Registry today, either at michigan.gov/organ donation or when you renew or get a driver's license or state ID. So with that, happy to take any questions.
Yeah, we're gonna, if you have any, if you're here in person, you get first dibs. And if not, we'll have to take them through the check. We'll put out a quick note, see if anybody asks.
Okay.
If not, we'll close it off.
All right. Well, I appreciate all of you being here today for this kickoff celebration, and I'm excited to keep joining you all around the state and see more of you, Hartley, and the joyful expression and joy that you bring to any room as we chart a course forward.
I think we're good.
Okay. Thanks, everyone. Thank you.